Dr. Jensen, welcome to One Dream Podcast.
Thank you, Leah, for having me on. It's a pleasure. We've had conversations before, and it seems like each conversation is more important than the last.
That does seem very true. And it's always great to sit down with you and talk about how do we move things forward for the people, for health, for freedom. And now here you are on the campaign trail to be Minnesota's next governor. So I just wanted to sit down and talk about some of your priorities and the priorities of the health freedom voters and get your thoughts as Minnesota's next governor. So we'll dive right into you have been outspoken about informed consent and about answering that need. So let's start here. When, if ever, does public health have the right to tell citizens?
That's a great question. I think we have precedent that has established that somewhat. First and foremost, probably with our water supply in terms of sewer and water. You'll see municipalities having laws requiring a source of clean water, appropriate disposal of sewer, and non-potable water. So I think from a public health standpoint, I think those things that we could potentially do that would adversely impact on others, that's sort of that guiding light. In terms of public health, telling an individual what they must or must not do, I don't think I can come up with any scenario where public health gets to do that, short of potentially an abuse situation where you might have one individual being abused by another, regardless of what the circumstances are that define that abuse. But I think in terms of individual choice, taking care of our individual bodies, particularly, I think, medical interventions, medications, treatment protocols for cancer diagnoses, vaccinations, all of those areas, I think we must draw a hard line and say, no, public health does not get to intrude into a person's life at that level. And I think that's partly why you and I are having a conversation, Leah. I've always been a skeptic. I've been in medicine for 40 years. And I would think that most of the residents and medical students that have learned from me as their preceptor would say that Dr. Scott Jensen is a skeptic. And I've always thought that being a skeptic was a fine thing to be, as long as you don't slide into that realm of being a jaded cynic. And I don't think I'm cynical. I'm excited about the human race. I'm convinced that we are created in the image of our Creator. And that's a glorious gift. But we're also created with free will. And that means that we can, at times, be an abomination, even to ourselves, with some of our decision making. But having said that, I think the COVID pandemic, as well as the influence of big pharma over the last 20 years, those two forces sort of combined to drive me towards being passionate beyond wherever I was previously on the issue of health freedom. I've studied it. I've studied Benjamin Rush, one of the pioneering voices about the value of health freedom. I've studied the relationship that Benjamin Rush had with George Washington. I've studied what happens in Africa when an Ebola virus causes an outbreak. And in my heart of hearts and in my analytical thinking, we must have health freedom, because as soon as we don't, the slope is so slippery that we will wonder, how did we get to this position?
I think I hear you when you say that there's skepticism and then there's cynicism. And I would vouch that you are a hopeful guy. That I've never found you to be a cynic, but it is prudent of us as voters and of our listeners as voters to stay skeptical, because there's this whole framework within the health freedom movement where some people are saying the main goal is to restore trust in government. And I have to disagree. I would say that we were never designed as a constitutional republic to hand over our trust to the government, but that we are supposed to be the ones that hold our government to account and vote for representation that will be held to account. And so it's interesting that you say, some people think that it's a negative thing to be skeptical, but when it comes to the for-profit industry and our government holding hands, we have every reason to be on guard.
Well said, Leah. Very well said. And on top of that, I think that we can speak of trusting voices. But I think when Reagan said 40 years ago that freedom is never more than a generation away from extinction, he wasn't just conjuring up fancy words. He was speaking honestly. And I think that kind of warning he was giving us exemplifies what you're saying, that we should not think the goal is to trust government. The goal is to trust our Constitution and this great American experiment of a constitutional republic, and make certain that the people we elect are going to stand for our individual protections. And I'm often struck by the power of the words of the preamble to the Constitution, where it says, "We, the people of the United States, in order to form a more perfect union." And then it lists off the 5 things: establish justice, ensure domestic tranquility, provide for the common defense, promote the general welfare, and secure the blessings of liberty. Those are the sacrosanct, that's our modern day Pentateuch, if you will. And I worry that in our election processes, in that very natural human process of prioritizing things, sometimes we might prioritize in a given election cycle that this is the most important issue and this one is subordinate. But we should never subordinate our individual liberties. And our individual liberties and the status thereof, I think, is reflected always by health freedom. If we don't have health freedom, our individual liberties have taken a hit that we probably don't even appreciate, but it will come back to haunt us.
Underneath health freedom are main pillars of liberty. And I think that's why it's such a good indicator of the strength of our constitutional republic, is because if you look at parental rights, religious freedom, privacy, free speech, all of those are pillars underneath health freedom. And so if one of those is suffering, then health freedom is suffering. And so it's almost this beautiful beacon of that goes off that's flashing when we need to take better care of what you just talked about in the preamble. And another quote by Reagan that I often use when testifying in public hearings is one of the most dangerous words is, "I'm from the government and I'm here to help." Dangerous words ever spoken. And the part that we have to recognize is oftentimes public health has become so bloated and encroached on fundamental freedoms because we lay all of our problems at the government's feet to fix. And we're at a point in history right now where we are stepping back to say, where is the allocation of responsibility with our health? Is it really the government's job to fix it? And are they capable of doing the job that we're giving them? And so I don't know if you heard Dr. Latipo and Governor DeSantis' announcement in Florida that the government or anyone else should not be telling you what to put in your body for the care of your health. And Dr. Latipo even likened vaccine mandates to slavery and vowed to end all medical mandates for the state of Florida. I don't know if you got to hear that press conference or have a position on Governor DeSantis and Latipo's announcement to potentially end all vaccine mandates in the state of Florida.
I did hear that press conference, and actually I had a chance to talk with Dr. Latipo after that, and he and I and Dr. Drew did a segment a couple of weeks ago. And I appreciate Dr. Latipo's unlikely journey, as he would describe it, and the fact that he has met his moment in time with strength and courage, because it's easy to let things slide. And I think that's one of the problems we have in our political system today is, as you said, the world of politics is an odd experience. When I was in the Senate for 4 years, it was as if winning on election night somehow, in the minds of too many, caused this notion to arise that legislators became more than mere earthlings. And I think both the elected leaders and the public fall into that trap. And what really happens is when you win an election, your obligation to shut your mouth and listen and learn intensifies. It doesn't diminish. You weren't elected because anybody thought you had all the answers. The day before the election, you were just one more candidate. And the day after the election, you just happen to be a candidate who got a piece of paper that represents an election certificate. But I think this is part of the problem is in the arena of health freedom, we have too many legislators who prioritize it as a lower tier concern. And as you said, it stands above many of the critical pillars of our constitutional republic. And if you don't have health freedom, then arguably your religious freedom, your freedom of speech, your freedom to do as you choose, all of these things are endangered. Another quote by Reagan that I oftentimes reflect on is Reagan says, government missteps when it goes outside the boundaries of protecting the people from the government. He said,
Mm.
government was never intended to try to protect people from people. And so I think oftentimes we allow our own personal, spiritual, and childhood journeys to give us the impression that we can shape what other people's privacy must look like. And that's a huge issue. And it's a particularly large issue, I think, with Republicans, because there's such a large swath of people who live not on the 5-yard line of either party, but instead they live between those 30-yard lines. And they want reasonable representative government by elected officials who are close enough to the midline stripe that they can shake hands with someone who might have a different letter before their name, but get the work done and recognize that individual liberty is the sacrosanct gift and responsibility for each citizen. And that's what I fear is that when we get so far astray that we forget that health freedom really is that sentinel guard on watch for all of us. And if that is compromised, we need to recognize everything else is just mere minutes, hours, or days from failing.
Yes. And I think one of the encouraging parts of what we're living through right now, going into the 2026 elections, where you will be one of 36 governor races, so this is a big year for the U.S. Governor races, midterm elections in Washington, thousands of lawmakers across the U.S., that there are issues that are long-standing, long-held beliefs that are being challenged for the first time in a long time. I mean, yes, these issues, and I'll give an example, are ones that people have been working on, but we're at a moment in history where they are actually being challenged and changed. So at Stand for Health Freedom, we believe that water should hydrate, not medicate. And that's another example of public health going outside its bounds to protect people instead of protect people from government. Because fluoride is the only thing that's added to water to treat the human instead of treat the water to make the water safe for humans. And what that looks like is now you're adding something with knowledge, that the government officials, whether it be at the state level or the local level, they acknowledge we are adding fluoride to water to treat tooth decay. So then at the end of the day, you have a government mandated medical treatment without a real decision. So what are your thoughts on government mandated water fluoridation?
I don't know if you recall, but prior to my going into medicine, I was actually in the seminary. But prior to going into the seminary, I was in dental school and I was president of my dental school class. And I remember during my dental school year that we had visiting professors from countries in Europe. And a lot of Americans have no idea that in Europe, most of the Western European countries do not fluoridate their water. They recognize very clearly that the ideal manner in which to incorporate fluoride into enamel is through the first 12 years of life and direct application, whether through toothpaste or varnishing the teeth with fluoride, whatever a parent chooses to do, is a far more superior way. The notion that we don't get to ask ourselves whether or not fluoridating the water could have a downside is the most dangerous thing that we're seeing. Bobby Kennedy isn't saying that he is the repository for real science. What he's saying is that we need to be able to ask these questions and to dig in. And I think that's the part that's astonishing to me, is that we've turned this issue into some hyper partisan rhetoric. We have to ask the question whether you're talking about fluoridating water or our casual recommendation to use Tylenol during pregnancy. These questions must be asked. Something has changed from a structural standpoint in our society in America. We don't live as long as other first world countries, and yet we spend 3 times what many other first world countries spend on healthcare. Clearly, what we're getting for our payment is unacceptable. And if we're not willing to take a close look at, is the emperor wearing new clothes? And nobody's bothering to comment on the fact that we're seeing silliness right in front of our eyes, because that's what's going on. So when it comes to fluoridating water, I don't think there's any question. We got to ask this. We got to ask these questions. We got to puzzle over this. Science is seldom settled. It's in flux. Some science is more reproducible than others. Some science, the power of gravity, has been with us for centuries and centuries and centuries. Other science is still emerging. But if there's one issue that has truly bewildered me over the last 9 months, it would be that Bobby Kennedy has been vilified for asking questions that most parents sitting around the kitchen table wondering how best to raise their children, keep them safe, protect them from unnecessary harms. These questions that parents would ask are exactly what Bobby Kennedy is saying we're going to ask.
Yeah, it is astonishing to watch people politicize their own health decisions. You know, you mentioned the Tylenol announcement, and what did we see on TikTok the day after the Tylenol announcement was pregnant women taking Tylenol on camera just to prove that they don't believe Trump. And it's just astonishing. But I've said this over and over again, and I'll share it with you. I think the best thing that came out of the Tylenol announcement by Trump and Secretary Kennedy was that the acknowledgement that there is division in the scientific community, that there are multiple viewpoints, multiple paths forward, and that not everyone agrees, because scientific consensus, this whole standard of care and a single standard of care, has really gotten us into a bad place in America, that we're all supposed to be able to tell each other what to do with our health. And even if your doctor can't convince you, it's your friends shaming you into the single acceptable path of how to care for your health. And so I don't know what your reflections were after the Tylenol announcement, or if you thought it brought anything good clinically to America.
I think that there are many notions that can be dissected and discussed in the wake of the comments by Bobby Kennedy and President Trump regarding Tylenol. One of the most compelling outcomes of this discussion on Tylenol that has been initiated by Bobby Kennedy, I believe, is the response by media. I think that media has helped try to create a narrative from their perspective, generate it, if you will, and then in lockstep, promulgate it. It reminds me a little bit of what the media tried to do with ivermectin and calling it horse paste. This is what the media does. They take something, and it's a legitimate discussion point. They pick a couple of things out of context. And oftentimes the people reporting on this don't have the knowledge base or expertise to even consider the science of it. But there goes media again, marginalizing people saying something that goes against their determined, generated, fabricated narrative. Every time they do it, I think people get a little smarter. And I think Americans are waking up to the fact that when media chooses to vilify someone because they want to have a conversation about hydroxychloroquine or ivermectin or off-label use of GLP-1s or the value of Tylenol. Anytime the media does what it's doing, people are starting to say, hold on, we've seen you play this out before. That to me gives me both fear and hope, Leah. My fear is that we're not learning quickly enough. My hope is that we're starting to recognize the pattern of what media will do to people who are willing to stand for a discussion on a scientific topic. People who are willing to stand for a discussion on the science of fluoride or Tylenol or off label use of medications are not the enemy. The enemy is the force that would have you stop that, that would not let you think that, that would tell you you have got to abide and subordinate your own viewpoint. That's the part to me that is fascinating about this discussion, is that we saw media do what media does because media folks want to be relevant, regardless of how idiotic they can be at times.
It's I think that, we're living through a period of time where there's so much information, and the information is fast, and the information is, people have become expert marketers even in their own right on social media, getting people's attention. And I imagine that makes your job as a doctor harder when people aren't just seeing media as a tool, as a reporter, but as delivering either truth or untruth. And so it's like, how do you convince your patients and even your constituents to assimilate information and use it within their own discernment instead of simply truth or untruth?
The media has become a weapon of manipulation. It has become a weapon of prejudice. An example, a researcher can have a pretty mediocre hypothesis, whether it deals with a medical device, a medical drug, whatever. But if they can get on the front page of the local newspaper, they can generate one, a much greater likelihood that they might get some funding that they otherwise would not receive. But two, they can generate a groundswell of support for something that shouldn't be supported yet. The science hasn't arrived. There's been no reproduction of this hypothesis that might truly be outlandish. But all of a sudden, a groundswell develops. People desperately want hope and miracles. So if on
Mhm.
the front page of the paper it says, try this, this will give your mother 10 more years of high quality life. This will give your spouse 20 more years to live with the cancer rather than die from it. The manipulation of the hoped for miracle is a powerful opiate
Mm.
that takes away our ability to think reasonably. The media plays a key role in this. Researchers recognize it today. Never in my 40 years of medicine have I seen so much blatant disregard for science than having a front page article on a new research investigation prematurely tell the public this is the best thing since sliced bread. This you need to embrace. Tell your congressman or woman, tell your legislator, tell your doctor, you need to have a piece of this action because you're ready for a miracle in your personal life. That happens over and over again.
Mm. Yeah, I mean, it is startling to think that that's how we're getting our news is filtered through talking heads instead of knowing that this is longstanding, that it's actually safe and effective, that this is something that has a track record of producing good results. And that's where we've gotten, I think, I mean, I fear, I don't know what your opinion is on this, but the future of personalized medicine and quote unquote fixing our genes. I mean, what is that based upon when we look at the Human Genome Project and we didn't get exactly what we wanted out of that? And then we look at epigenetics and how environmental factors play such a humongous role in our expression of health, but yet personalized medicine based on your genetics is driving forward full steam. And do we know the long term effects of trying to quote unquote fix our genes?
No question about it. It's driving fast forward and there's no stopping it. It's a two-edged sword, Leah. I mean, the notion of being able to use CRISPR technology to alter the gene for sickle cell anemia is a powerful motivator, no question about it. A hellacious life being reversed. The potential for identifying one or two or just a few genes that could potentially be repaired, causing some of the storage diseases that we have, taking a person from a hellacious life to a high quality life. These are powerful motivators, no question. I think that it gets back to informed consent. I really do. I think that if we're going to use products off label, if we're going to say no thank you to products, if we're going to say we don't want to use that FDA approved product, we would rather try this unapproved supplement or herb. All of these things pivot around informed consent. Physicians shouldn't be some sort of taskmaster for the patient. Physicians should be the resource. If we don't know or don't understand something we're being asked about, say it. I get that all the time. And I don't know. Sometimes I casually reply, it's above my pay grade. I think we have ignored in Western medicine the potential benefits of discoveries made centuries and centuries and centuries ago. The notion of electromagnetic powers, of minerals and rocks and things like that that could have curative capabilities. We've ignored because it hasn't been able to be put inside a prescription bottle, or it hasn't been able to be something that we could take a scalpel to. We need to absolutely always come back to home base. And home base for me is informed consent. We acknowledge what we don't know. We state appropriately at what level we do know something, and we work together with the patient as to whether or not this is something they want to try, not try, or whatever. We almost have to go back to what did medicine look like in the pioneer days in America? It was never some sort of command structure where someone was here and someone was here. It was an assessment and an evaluation by someone who was presumed to have some level of expertise, and then a discussion. I think you have this. I think your daughter has this. I think your son has strep throat. Whatever. There was a discussion and a plan was settled on and an attempt to heal was brought about. That's where we need to be. If we think that we can replace the decision-making of the patient with knowledge, intimidation, statutes, we're just wrong.
And something you said, attempt to heal, and that was the practice in the pioneer days of medicine, was an attempt to heal, not manage numbers that we could measure, which I think is one of the missteps. But talking about curative power, that brings me to another issue that our voters care deeply about right now, and that is access to healthy food, options for healthy food. So there's this swath of policy ideas about small-scale farmers and deregulating the small-scale farmers and the food-based or the home-based food vendors so that we can take our food supply from a couple hundred successful farmers in your state to thousands. Because not only is that a good idea for the local economies, but also for food security. I mean, we think back to COVID when we were being threatened with food supply issues. If you decentralize the food supply, you have better food security. So what are your thoughts on the risks and benefits of deregulating small-scale farmers and home-based food production in Minnesota?
As a general rule, I'm a big advocate for minimizing the necessary level of regulation in almost anything, because I think the free marketplace is the best place to achieve innovation as well as efficiency. Having said that, I think that those kinds of what if considerations we might think about, we have to be always mindful of the potential for unintended consequences. We might think that this makes sense for government to do this or to deregulate this, and then something springs up where we realize, whoops, we probably should have put up a couple of guardrails. For me, one of the imperatives is in the United States, we have a tendency, I believe, to be at a certain level arrogant about our view of the world. I think we need to be more mindful of the fact that there are many first world countries around our planet, and we frequently have been driven by the almighty dollar or potentially the collusion that can take place between big pharma and government, or the collusion that can take place between big pharma and big tech. I think that if we've got some 40 to 50 ingredients in our food chain that most European first world countries are prohibiting, we should be asking ourselves, why are we doing this? Why haven't we followed suit? Sometimes I think in American medicine and in the study of American nutraceuticals, we're not paying attention to what others are saying. So I think we need to step back from a position of potential arrogance, recognize what other countries are doing, and saying, maybe that's where we should be heading. And to your specific question about regulations in agriculture, I don't think there's any question that sometimes our regulations are not the product of good science, but frequently the product of interference, sometimes feel good virtue signaling, and we find ourselves trapped. And I think virtue signaling oftentimes is ascribed to one political party or another. But I think we need to recognize that virtue signaling is something that is part of the human nature, and we have to be on guard against it.
There's there's definitely a lot of virtue signaling going on right now as it relates to the market share in the food industry because the demand for regenerative and organic foods went up exponentially over the past few years, and they don't anticipate that that demand will slow down. And so you see companies like Walmart that are now making promises to clean up some of their food, but they're also coming out against small scale farmers. And, they're showing up at the state houses to testify against bills that would create more opportunity for small scale farming in that specific state. And one way we've seen this pop up is, and obviously there's room for all types of farming in the US, and we're not here to be the arbiter of what is good or bad farming. However, one of the things that we've seen across the US is these bills popping up to protect Bayer Monsanto and, as a byproduct, the entire chemical industry from frivolous lawsuits, quote unquote frivolous lawsuits that, they're getting all these lawsuits for non-Hodgkin's lymphoma, and they're sick of these lawsuits and they're threatening to pull out of the industry if we do not give them, if the state lawmakers, if Washington does not give this industry a liability shield from these types of lawsuits. And what they're saying is, hey, just say that the EPA approved label is automatically satisfactory to fulfill their duty to warn. So all of our duties to warn customers have been fulfilled if we have an EPA label. And what people don't understand is what that does is it closes the courthouse doors for you to bring a lawsuit that said that they omitted something that they knew that they should have included. Have you heard about this trend going on of reducing frivolous lawsuits by giving liability shields?
I think liability shields have been demonstrated to be problematic in ways totally unable to be anticipated. I think when you go back to 1986 and you see Reagan signing the bill in regards to providing a liability shield for pharmaceutical companies in regards to their research for vaccinations, we should learn valuable lessons from that. What many people don't realize is that conversation began many years before 1986. In 1976, pharmaceutical companies were not going to be willing to make a flu vaccine against the swine flu until Congress knuckled. And when Congress knuckled in 1976, that put into play the process that ultimately culminated in 1986 to double down on a liability shield and, in a sense, protect chemical makers from the liability that they should be exposed to is problematic on multiple levels. We saw it literally with our soldiers as the military exposed many soldiers to Agent Orange for not days or hours, but for months or years. And subsequently, we saw the development in some units. Literally 50% of the unit would develop Parkinson's disease before these young men and young women before they reached the age of 60 or 65. So these kinds of liability shields should absolutely send up a red flag for anybody, because when we do that, it's sort of like putting the fox in the henhouse. And we've got to learn from this. And I fear that we're not. And sometimes I think politicians are so captivated and mesmerized by some of these large scale lobbying efforts. I mean, I was in the Senate for 4 years. I remember carrying some big bills, thinking that we were making good headway and that we were in the home stretch, only to realize that it oftentimes wasn't until the 11th hour that your big players, your pharmaceuticals, your health insurance companies would come into the equation. And they would come in not with a few knives or swords. They'd come in with nuclear weapons. They'd come in with bombs and bullets and anything they could come up with to derail your efforts. They didn't have to do it early on in the discussion. They could wait till the 11th hour, and all of a sudden, what you thought you'd be able to accomplish was turned upside down and left in shambles. This is the way they work. So if Walmart is willing to put on its shelves a certain kind of food in order to appease its customers, that's one thing. But don't for a second be deluded thinking that this is Walmart's consistent position. They may well have a political arm of their organization that is doing the exact opposite, trying to put Walmart in a position where they won't have to put those foods on the shelves that you want, and that they're willing to do so for a period of time to keep your business because they've got a long game. You may be playing checkers, they're playing chess.
Yeah, I have the same questions, Dr. Jensen, about what does this look like in 2 years and 3 years with these products when it's all a game of trust, when it's a game of showing up with the sexy message that people want to hear today. But, one issue that I never thought that I would live to see as talked about in the mainstream is weather modification. And I don't know if you hear about this from your constituency at all, but a growing number of states are re-examining what it looks like to permit weather modification in putting interventions in the atmosphere. And one of the biggest concerns is aluminum, that aluminum and other metals and chemicals are used in these processes that are ending up in our crops, water, soil. Would you support an investigation or a ban or moratorium into weather modification for Minnesota until there are more answers?
I think the conversation regarding statutes sometimes takes place on a preliminary basis where we need to recognize that weather modification could have I mean, arguably, you could talk about weather modification or you could talk about modifying the impact of weather. I mean, two different things dramatically. Early warning signs for hurricanes and tornadoes, a great idea. Modifying weather because we don't like the pattern of rainfall that we're getting, a potentially terrible idea. So I think we need to make certain that we recognize where the research is at and where it's not at. And I think sometimes the media and even the podcasters, I think sometimes we can get ahead of ourselves. I think what we know about weather modification right now will comparatively fit in a thimble at the present time when we look at it 25 years from now. So I think that answering questions about what if this, what if that, I think that potentially distracts us from what we need to do. What we need to do is recognize that there's nothing like discussion. There's nothing like listening and learning. We need to have term limits so that we don't have people serving in public offices that have oversized authority, that don't have the knowledge to understand what they're dealing with. We're letting large companies buy legislative influence. That's the danger. So if weather modification gets out of sync with our knowledge, the most likely reason will be because of money going from lobbyists to representatives. And I think we really need to focus on our legislative process. We can pick and choose this issue and this issue and this issue. But if we don't have term limits, if we don't somehow get back to good governance and what does representative democracy look like, we're always going to be one more issue, one more piece of throwing mud on the wall to see what sticks and what's really problematic. We've got plenty of issues that you and I have talked about just today, Leah. But it all centers, I think, back on our process of listening and learning. And we've talked about the value of how informed consent can be the true north for a discussion about health freedom. You make a good point. Can you have actual health freedom if someone else is engaging in premature science of trying to modify weather with chemicals that could absolutely decimate your own pursuit of good health? If we know that aluminum may play a role in early onset dementia, as well as many other disease manifestations, do we want to let one group of people willy-nilly proceed over here? And yet we have to understand that the atmosphere is a shared responsibility for all countries across the globe. How do we deal with that? For me, as a person who spent 4 years in the Senate and said, I've had enough, I think, quite frankly, we've lost our minds. I keep coming back to informed consent, health freedom, term limits. I think that what we're ending up, we oftentimes have a very truncated conversation because it's the 5-yard liners on the left and the 5-yard liners on the right that are dominating the conversation. And those moderates in the middle who live in between the 30-yard lines are saying, what in the devil happened to reasonable conversation? Why can't we solve some of these problems instead of simply making them political hot potatoes? That's where I land on a lot of this stuff. We're too presumptuous. We're too easily recruited to one perspective or another. A liability shield is something that I'm glad you brought up because I think that when we do a liability shield, we're absolutely corrupting the natural process of observation, hypothesis, and then devising ways to study, learn, and understand something more deeply, which is what science really is.
And we've heard from the EPA when in our discussions with them, because we talk to state lawmakers at Stand for Health Freedom a lot. That's a lot of our work is interfacing with state lawmakers. And so the state lawmakers' understanding is the EPA has it covered. So we go to the EPA and we're like, here's what's happening. What are your thoughts? And one of the things that we uncovered in those meetings is that the EPA depends upon these lawsuits to reassess labels. Because if these lawsuits aren't being brought and new and hidden information isn't being exposed, then the EPA doesn't have what they need to continue the reassessment and the reform of labels. So it is interesting to think about what that does to natural process and to the natural protection of the public from industry.
I think you have raised a very good point, Leah, that really does need to be highlighted from our conversation. And that's when you use that phrase, closed the courthouse doors. Anytime we take an action that closes off one of the 3 branches of government from the everyday person, we have absolutely violated a pillar of our democracy. And it happens quietly in the dark of the night. It isn't something that's broadcast. I think we're seeing it even today, and I'm no lawyer, but I think we're seeing increasingly the courts throw out legitimate concerns by saying that the plaintiff doesn't have standing. For a lot of folks, they say, what does it mean? Well, you can have all kinds of analytical dissecting conversations by constitutionalists and lawyers. But as a layperson, it seems very obvious to me that if judges and courts want to use you don't have standing as a way to clean up their workload, it would be an easy way to do it. And we're seeing it happen frequently. You don't have standing. And yet the basic principles of standing, being who caused this? Was there harm? Can it be remedied? These kinds of things have happened. And people have seen the courthouse doors closed off to them. So thank you, Leah, for putting that on the table, because I think frequently that happens when inappropriately a liability shield is allowed to be passed into law.
Yes, standing's a huge issue, and so is mootness. When we saw whole um, areas of law wiped that we felt we had progress on during COVID to say, look, they're recognizing that these mandates were an overreach of the government, and then all of a sudden now they're moot because the government doesn't have mandates anymore. And so that these cases were no longer relevant when it came to the case law that would be considered in the following pandemics. So it is a dance of what are we closing off and what are we allowing to work as it's supposed to. And you've said your campaign is about restoring Minnesota's safety, opportunity, and values. So how does health freedom fit into that overall vision?
In Minnesota, I don't think anybody really should argue that it's a blue state. I mean, we in Minnesota has not voted for a Republican presidential candidate since Richard Nixon. Having said that, I think Minnesota is a particularly divided state, fractured, if you will, following the pandemic. We need to heal. And one of the best ways that we can heal is for us to come together on issues that provide hope for a better tomorrow on the parts of everyone. And I think one of the ways to do that is health freedom gives us that. If we can all acknowledge that there are matters of privacy that transcend policymaking, if we can acknowledge that on many issues that are intensely personal, arousing intense ideologic perspectives, if we can acknowledge that politicians are not up to the task, that they politicize virtually anything and everything, I think that's a starting point. We can heal. So in Minnesota, I'm running on the basis of what does the everyday person think good government looks like? For me, I think good government looks like an affordable cost of living, accountable government actions always. Fraud cannot be allowed to run free rein. We need to recognize that competence has to replace chaos, but we also have to recognize that we're an affluent enough society that it's appropriate for us to have compassion and to have a safety net there for people who are down and out. But we need to make it clear a safety net is not to be a destination place. It's supposed to be a ladder so people can climb out of that space, dream dreams, and go achieve them. We need to recognize that kitchen table issues matter. Inflation, the economy, rampant crime, putrid educational outcomes. These things matter to everyday folks. That's what I'm trying to remind Minnesotans of. This doesn't have to be so partisan. We can get good work done. Who doesn't want their child to be well educated? Who doesn't want their neighborhood to be safe? Who doesn't want the cost of gas and groceries to drop? Who doesn't want their wages to rise more rapidly than the inflation rate? How do we fix these things? We got to stimulate our economy. We've got to use tax credits to get the engine of our economy going, which is small business. It isn't adding more government jobs that arouse a revved up economy. It's the private sector. And we need to recognize that it's not Fortune 500 companies that drive the Minnesota economy. It's small business. We need to go on offense against fraud. You can't sit there and wait for it to happen and then, pull out your hair, gnash your teeth, and tell the public you're so sorry that this is happening. We need to recognize that college has been oversold. The trades are really how you build America. We've got to create a workforce more rapidly by using technology. We got to recognize that we don't need more taxes. Good government will come from the private sector growing. And these are what we have to do. So that's what I'm running on. I understand that people are powerfully motivated on those personal ethical issues. But so many times our deepest convictions are born of our upbringing and our place of spirituality or religious belief. And if we truly believe in the separation of church and state, then we must recognize boundaries. And that means people have personal privacy. And if they have personal privacy, first and foremost, they have health freedom. If you don't have health freedom, you don't have personal privacy because you've given away the right to tell government, you can't tell me what treatment I have to consent to. We have to be able to tell government. We need the information and we need the right to make a voluntary decision. You don't get to take that away from me as an American.
Yes, and I think one of the things I always look for in a candidate, we want to, as voters, we want to measure, is this person going to stick to what they've just promised me? And one of the key indicators is, does this candidate have an outside reference point that is bigger than themselves, which creates humility, which creates faith and sovereignty in a way that can't be held without that. And so having that reference point that is bigger than yourself, and I've heard you mention creator multiple times, and I've heard you mention the bright future and plans that there really are for each of us. And so, Dr. Jensen, I just want to thank you for your leadership and for taking time to have these types of conversations with me so that your voters can be informed, and that you fully support informed consent is a beacon of hope as a physician and a former lawmaker and as someone who is now running for governor of Minnesota. So for our listeners, you all can find Vote for Health Freedom resources at standforhealthfreedom.com. And Dr. Jensen, where can they find more about your campaign and platform?
You can find it at drscottjensen.com. That's our website, DRSCOTTJENSEN.com. And to that larger frame of reference that you made comment on, Leah, I would say this. Being a family physician in the trenches has been the gift that keeps on giving for me and my family members who are physicians and are involved in everyday care of patients. But it also does create a very fertile field for recognizing how human we are. In the world of medicine, there's plenty of opportunity to help, but there's, by mandate, plenty of opportunities to learn when we fall short. And as a physician, I have seen so many times my efforts have fallen short, but it's the efforts of others that have stood instead. I think of some of the nurses that I've worked with, how they were the ones who stepped into the breach and were able to do more for my patients than I was. I think sometimes of just our front desk people at a clinic being the ones who connect with patients in a more powerful way than perhaps the physician. So humility is something that perhaps all of us need a little bit more of. But in the world of medicine, I have been given plenty of opportunity to have the touch of humility on my life. So thank you, Leah, for letting me join you on your show. I appreciate it more than you know.
Absolutely. 2026 is going to be nothing short of an exciting year for health freedom policy and for the elections coming up. 36 governor races, thousands of lawmakers at the state level, midterms in Washington, and it's our job, you listeners, I'm talking to you now, that it's our job to use our voice and shape the future for our children, because otherwise the industry will do it for us. So make sure that you subscribe to the One Dream podcast and share this episode with a friend.